Namaskar, I am Dr. Kiran, orthopedic spine surgeon and rheumatologist. Today, in this continuing orthopedic education discussion with all the members of the International Research Trainee Program for medicos, doctors and biomedical engineers, we have a few questions. 10 of our members are asking me questions about why are we neglecting osteopenia in the youngsters? In a common man's language, why are we neglecting bone weakness in the youngsters? It doesn't mean that every youngster is having bone weakness. It doesn't mean that every youngster has no bone weakness. If you don't test them at all, how do you know? And the repercussions are quite severe. There's a lot of confusion about how you see the bone density. Are you going to do an lunar, meaning ultrasound Achilles heel bone density test, or you prefer to do a DEXA, dual energy X-ray absorptiometry? It's a big machine, it cannot be taken portable anywhere. Whereas the ultrasound heel to see the stiffness there. Trabecular bone score, TBS has come now recently. So many things are changing. So unless we really know about it, you're going to let the young man or young woman suffer with many complaints, saying that no, it's just bone weakness, you're tired, you're fatigued, go for exercises. No, you have to first ascertain what is the problem with the young individual, isn't it? So let's roll on now.
What are the symptoms of osteopenia?
It's a great question, Praharsha. Since it's a silent pandemic, suspicion plays a role. Receding gums, recent fractures in the young, unexplainable pains.
So, Dr. Kiran, when does low bone density usually occur? And is it always among the adults?
Fantastic question, Maliha. It can occur from the mother's womb to the terminally ill to the aged. Diphosphonospondylodysostosis, a genetic problem. Congenital hypophosphatemic rickets, it's also genetic. Osteogenesis imperfecta, collagen problem, it also arises due to genetic. Low maternal values of vitamin D can lead to fetal vitamin D deficiency, compounded with enzymatic, genetic and receptor resistance leading to weak bones.
So hi sir. So when we see a DEXA scan, there are T-score and Z-score in the scan all over. So what do they exactly mean?
Wonderful question, Kabilesh. T-score is a measure used after 50 years of life, post-menopausal period. When it is compared, the BMD, bone mineral density, is compared to that of the peak bone mass density of an individual. Z-score is useful for younger people because they didn't reach their peak bone mass density yet. That's why Z-score is comparable to the same age, race and gender. I would like to say this way, at 20 years, I would like to do a DEXA scan and compare the Z-scores. There's always a conversion between T-score and a Z-score, and also T-score of the Western Caucasian models database and our ICMR database. We can have these formulas like I showed you.
Is DEXA scan safe, sir?
Aisha, it's a very good question. 100 chest x-rays are equal to 1 DEXA scan.
Doctor, how many years have you been collecting the BMD test reports and correlating the data?
Since 2000 till now, I've been presenting papers. Totally around 5,000 patients have been seen.
Why is detecting low bone density at the age of 20 very important?
Shabir, it's a very, very good question. By doing a DEXA scan at the age of 20 years, the peak is reached at 30 years. So we have 10 years time to modify the lifestyle so that the shift to the left can be prevented. The peak BMD can be achieved. Once the peak is achieved, it plateaus in both males and females. Longer time in a male, then they gradually fall. So lower peak means higher risk.
Sir, how can we better understand peak bone mass in both males and females? Do both genders reach peak levels equally?
Very good question, Sagarika. Peak reached in a male, the bone mass density is higher than the female, and if it is suboptimal, the fall also will be greater.
Doctor, a question I have for you is, in your clinical experience, have you come across any patients with severe osteoporosis in patients as young as 20 years old?
Great question, Ajin, and that's the reason why I'm presenting this subject before the public.
Doctor, have you recorded evidences of improvement with sequential BMD scans and the treatment?
Of course. And there was a patient who never trusted us, came back after 6 months, her BMD was same. Another patient improved after treatment. You can see it on the screen.
How do you explain if bone density is normal at one side or osteoporotic at another side?
That's a rare question, Andan. T-score discordance is the word given to this. So normally if you have a generalized osteopenia, it's a different story. We can start the treatment. But when there is a T-score discordance, different levels at different bone sites, then becomes a little problem while deciding when to start the treatment. So by switching to ICMR data, we can come near to the realistic T-scores and Z-scores as per our Indian population. Now in this slide, what you see, it is BMC musculoskeletal disorders publication in 2025 showing that ICMR data shows when we do a BMD testing more normal people than when compared to the score given by the standard, that is the Western Caucasian database using BMD DEXA machine. Which means more number of normals are diagnosed as osteoporotic or osteopenic. Hence, we should develop a DEXA machine with Indian databases which were revealed by the ICMR, which is the need of the hour. When we can develop our own aircraft, we should henceforth also concentrate on developing our own medical equipment. One more reason why we should develop our own DEXA machine with Indian databases is we are a 14 billion population and also we are one of the leading countries having the largest proportion of osteopenic and osteoporotic patients in the whole world. So, isn't it time we evolved and innovated and designed and developed our own equipment where Indian databases are used. Also, it may be useful to note that our physical characters, Indian physical characters, suit Nepali population, Bangladeshi population, Bhutanese, Sri Lankan and other neighboring countries. If the Indian government and Indian Council of Medical Research, ICMR, can collaborate with the neighborhood countries, their governments, and make a common Asian database for BMD. Maybe one day we'll have a specific DEXA machine, trabecular bone scoring machine, where we'll have reliable T-scores and Z-scores of comparable nature so that false positives can be avoided and the true cases can be evaluated for research. And if we can innovate and design a machine which is as small as a ultrasound carryable mobile unit, then maybe the whole world will be in awe with what we have developed. Best of luck, my friends. Never disregard a young person or even a child who says have pains, so many other complaints which can appear in osteopenia.